Regarding the second question of commoditization of radiology, I have very strong feelings. Having been a clinician myself, I think it's very important for radiologists to have a face. This means attending more tumor board conferences, attending more interdepartmental meetings. These are really helpful. There have been studies which show that if a radiologist presents at the tumor board, the change in the management of the patient is seen in almost 30 to 40% of times. So given this kind of a picture, it's really important for the radiologist to get involved in all these interdisciplinary meetings. Personally, I've been at a hospital where they used to have morning radiology ER conferences every single day, and attending or a resident would go over all the cases that were seen in the ER the previous day. This was really helpful twofold. One, because the radiologist got to see the entire clinical scenario, and this was put forward by the ED doctor. It's different reading stuff off the EMR, but when a attending physician explains the clinical situation, it makes a huge difference. And secondly, for the ER doctors, it was helpful because they got to know the kind of studies to order and what was going on in the radiologist's head when a long differential was put forth. So it's really beneficial so that other doctors get to see who the radiologist is behind the reports. With respect to commoditization, a commodity can be valued in terms of its price and in terms of its service. The price we might not be able to match, but we have to make it up in terms of service. So if the service is extraordinarily good, then the price really doesn't matter. That means providing real good service, which includes turnaround time, try and get the studies done as early as possible, 24-hour coverage, and providing a pleasant experience for the patient. Personally, I think when a patient's waiting to get a study done, the patients are really apprehensive, so it helps if magazines are kept in the waiting rooms, and small things can be done to make the service better. Like, for example, I would like to have my car clean while I'm trying to get a study done. It really helps. And then adding value to the service also means looking up the patient's history, looking up the drug history, so that you can give a concise differential instead of a long differential, which is not very useful. There's been one instance where it really mattered when we looked up the drug history. So there was this patient who had dilated loops of bowel without any features of obstruction. There was some thickening of the small bowel all along. So when we looked up the history, we saw that this patient was on an ACE inhibitor, and it kind of made sense. So we said ACE inhibitor induced angioedema of the small bowel, and the patient actually recovered. Once the ACE inhibitor was taken off, the patient's bowels, the abdominal pain went away and the bowel improved. So I think it's really important to put forth a small differential, keeping the clinical scenario in mind, and it adds to the value of a report.